everyone, I'm Dr. Jordan Diener. I'm a uveitis and vitreoretinal surgeon at Mid-Atlantic Retina, the retina specialist of Wills Eye Hospital.
My name is J.P. Dunn. I'm the director of the uveitis unit here at Wills Eye Hospital in the retina division. The uveitis is really more of a description than a diagnosis. There are dozens of different types of uveitis that all have different symptoms and complications, just as there are many and varied types of arthritis or cancer or gastrointestinal diseases. In some cases, the uveitis is mild and transient. In other cases, it's severe and it can cause blindness. Some types of uveitis, I should say, affect only the eye. It can be one or both eyes. And in other cases, the uveitis is part of an underlying systemic disease.
The most common symptoms and signs of uveitis consist of decreased vision, light sensitivity, floaters, flashing lights, and a red eye. The best thing you can do if you are having these issues is to seek out care with an ophthalmologist.
Patients can get uveitis at any age. The important thing to recognize is that the diseases that cause uveitis in those different age groups vary. So what you are more likely to get as a child causing uveitis is very different from what you might get as, say, a 70-year-old. Average age of onset of uveitis is around 38 to 40 years old. We also see variations according to ethnicity and race. So some diseases that we see are more common in African Americans, some are limited to Caucasians, some are more common in Hispanics or Asian Americans, some are more common in people from the Middle East. So all of those come into play when we're making the diagnosis.
The prevalence of uveitis is estimated to be 38 cases per 100,000 individuals. Despite its rarity, uveitis is the fourth most common cause of blindness amongst the working age population in the developing world, making it a significant disease of concern. This really depends on the cause of the parent's uveitis. We have linked some forms of uveitis, like HLA-B27 uveitis, to specific genes, which can be passed on to your children. Other forms of uveitis are acquired and unlikely to be passed on to your children. The best way to get an answer is to get a diagnosis from a uveitis specialist.
That's always the first question that patients ask when they come into uveitis, because invariably they have Googled uveitis, and the first thing they see is blindness. And in fact, there are some types of uveitis that can certainly cause blindness, but most types of uveitis are eminently treatable. It doesn't mean that the vision is going to remain perfect or get back to perfect, but we can often make it much better than it was when the patient first came in. One of the most important factors that predicts poor vision or blindness in patients with uveitis is a delay in a referral to a uveitis specialist.
Making a diagnosis of uveitis begins in the office with a careful ocular exam. Often we will use advanced imaging techniques like optical coherence tomography, or OCT, and fundus autofluorescence to better understand the cause of the ocular inflammation. Occasionally, we will inject an orange dye called fluorescein into a vein in the patient's arm to look and see if the vessels of the retina are affected. After we have done a thorough examination, we generate a list of possible causes of the patient's uveitis. Typically, we will then ask the patient to get blood work and radiology studies to assess for common infectious and autoimmune diseases that could be the cause of their ocular inflammation. However, about 50% of cases go without a clear diagnosis. We know that these cases are still caused by autoimmune disease and that they respond well to therapy, but we just can't quite fit them into a nice box and put a label on them. Treatment of uveitis is based upon first determining whether it is caused by an infectious or an autoimmune disease. Infectious diseases are treated with appropriate antibiotics or antivirals. Uveitis caused by autoimmune disease requires us to treat with medications that turn down the immune system. Thankfully, we have a vast array of therapies available to treat uveitis. Our options begin with anti-inflammatory eye drops. More advanced disease is treated based upon several factors. Is one eye or both eyes involved? Does the patient have autoimmune disease affecting the rest of their body? does the patient have other medical issues? If only the eye is involved, then local steroids given into or around the eye remain a good option. We now have steroid implants that can last out 3 years. When there's other body inflammation, then temporary use of oral steroids followed by an oral, injectable, or intravenous therapy called immunosuppressive medications are given to control both the uveitis and systemic inflammation.